Hello everyone. The coalition we chose was Substance Abuse Prevention, and the organization we focused on is the National Council on Alcoholism and Drug Dependence, Inc., that goes by the acronym NCADD. In this presentation, we will introduce all members of our group, followed by the case study overview that consists of coalition overview, testimonials, facts, and data. Moving on to the analysis that highlights case strategies and effectiveness of the coalition's approach. Then looking into challenges the coalition encounters, addresses, and overcomes. Next, we will discuss the applicable concepts and theories, concluding our presentation with our summarized key takeaways and recommendations based on shared insights. The members of our groups are myself, Jessica Lopez, Heidi Moalam, Christian Mosqueda, and Julio Cordova. Substance Abuse Prevention Purpose. Substance abuse coalitions are collaborative groups that cooperate together to address and prevent abuse issues in communities. These coalitions often involve a combination of community members, organizations, law enforcement, healthcare professionals, and government agencies working together to combat substance abuse problems. Overall, substance abuse coalitions play a crucial role in mobilizing communities, coordinating efforts, and implementing effective strategies to prevent and reduce substance abuse, ultimately leading to healthier and safer communities. Christian will now be speaking on the coalition's overview.
Thank you, Jessica. The National Council on Alcoholism and Drug Dependence, or the NCADD, is a nonprofit organization founded in 1944 by Miss Marty Mann, the first woman to achieve long-term recovery in Alcoholics Anonymous. Originally named the National Committee for Education on Alcoholism, its mission was to educate the public about alcohol use disorder as a disease. Over time, it expanded its focus to include advocacy, education, and support services under the name National Council on Alcoholism. Recognizing the interconnected nature of alcohol and drug use, they further expanded their focus in 1990 and adopted the name National Council on Alcoholism and Drug Dependence. These changes highlight the coalition's evolving mission and expanding focus, adapting to the changing landscape of substance use and public health. Today, the NCADD's mission is to increase public awareness, provide education and advocate for effective prevention, treatment, and recovery service, and support individuals and communities affected by substance abuse issues. The NCADD, as any coalition, has many goals, but pursues three primary ones: prevention, support and resources, and effectiveness in their endeavors. Prevention efforts include raising community awareness, promoting policies to reduce youth access to substances, implementing prevention programs, engaging youth in prevention efforts, and providing positive alternatives for kids and teens. Support and resources goals involves offering assistance to individuals and families affected by substance abuse and advocating for increased funding for programs like counseling, therapy, and sober living. The effectiveness goal is evaluated through monitoring and assessing program outcomes, community-level indicators, and gathering feedback via surveys, interviews, and focus groups. This evaluation helps the NCADD make informed decisions about program improvements and changes to ensure their efforts are evidence-based and impactful. The NCADD collaborates with various groups, including local nonprofits, health centers, advocacy groups, and government agencies at the scope of local, state, and national levels. They also partner with hospitals, clinics, treatment centers, and educational institutions to enhance addiction treatment and prevention efforts. The NCADD operates nationally but adapts its strategies to meet local needs, advocating for improved addiction laws and running campaigns to reduce shame surrounding substance abuse. In summary, the NCADD plays a crucial role in uniting diverse groups to combat substance abuse, promote public health, and support individuals in recovery from addiction. Ahead, we have testimonials from people that benefited from the NCADD.
At the age of 29 years old, I decided that I was sick and tired of being sick and tired, and I went for help.
And so I sought help.
I made a decision to quit using drugs and alcohol.
While incarcerated, I was able to start a 12-step program.
I just made a conscious decision to put down the drink.
And my life is completely transformed.
I won't say it wasn't hard, but one day at a time I was able to recover. You feel free, you feel hopeful. There's nothing that you can't overcome.
Because of my recovery, I have a husband and a son who have never experienced my active addiction. I am the Chief Executive Officer for the Council on Alcoholism and Drug Abuse of Sullivan County. I have a loving family, I have loving friends, and I have a beautiful life right now.
Next, Julio will share some impactful statistics as they relate to substance abuse.
Alcohol is often seen as a social norm, but it can have devastating effects on our health. Excessive alcohol consumption takes a toll on our liver. Chronic alcohol abuse leads to liver inflammation, fatty liver disease, and ultimately can lead to death. Alcohol, when combined with tobacco use, significantly increases the risk of oral cancer. The mouth, tongue, and throat are vulnerable targets. Regular alcohol intake damages the delicate tissues, paving the way for cancer. Over 40% of hospital beds house patients with alcohol-related issues. These include alcohol poisoning, liver complications, accidents, and mental health crises triggered by alcohol abuse. Our health and well-being depends on raising awareness about responsible drinking. Some additional statistics analysis published by the National Institute of Drug Abuse, NIDA, subsidy of National Institute of Health, NIH, addressing the public health crisis and the total U.S. drug overdose deaths between the years 1999 to 2021. Data shows that annually, approximately 88,000 deaths are attributed to excessive alcohol use alone, making it the third leading lifestyle-related cause of death in the nation. Among males, 94,362 approximately deaths are from excessive alcohol use, which has increased approximately 27% since 2016, and 58,701 among females deaths has increased 35% from 43,565 per year to 58,701 since 2016. I will now be followed by Jessica.
The National Council on Alcoholism and Drug Dependence has demonstrated effectiveness in its approach through 7 key strategies. First, impact on awareness. The NCADD has been successful in increasing community awareness and education about substance abuse through various campaigns, educational programs, and outreach efforts. Second, policy influence, as they have played a significant role in advocating for policies and practices that reduce access to alcohol and drugs among youth. Third, resource provision, by effectively providing resources support for individuals and families that have been affected by substance abuse. The fourth strategy, program implementation. The NCADD has demonstrated success in implementing evidence-based prevention programs in both schools and communities. The fifth strategy is collaboration and advocacy, as the NCADD has been actively collaborating with law enforcement agencies, community organizations, and government entities. The sixth effective strategy is youth engagement, as the National Council on Alcoholism and Drug Dependence has been effectively engaged in youth prevention efforts. They have been provided with positive alternatives to substance abuse and involving them in awareness campaigns and educational activities. And the last key strategy is monitoring and evaluation. The NCADD has shown a commitment to the effectiveness of the coalition's activity by conducting regular assessments and outcome evaluations, ensuring that their programs and initiatives are achieving their intended goals and making a positive impact on the community. Heidi will now be speaking on the challenges of the coalition.
Thank you, Jessica. We will begin with reviewing the challenges faced by the NCADD, how these challenges are addressed, and the necessary steps the organization takes in overcoming these challenges. Stigma and perception. One of the significant challenges NCADD faces is social stigma. This stigma prevents many individuals from seeking help due to the fear of being judged. Additionally, public perception greatly influences the support and funding that the organization receives. Funding and resources. As a nonprofit, they rely on a mix of government grants, private donations, and fundraising events. However, the competition for these funds and the uncertainty involved can limit the ability to sustain and expand the services. Policy and advocacy. Advocating for supportive policies is also challenging due to the varying political landscapes and priorities. Legislative changes and budget unpredictability means that the NCADD must continually engage with policymakers to secure the necessary funding and support for their mission. Access to treatment. Ensuring that access to affordable and effective treatment is mostly difficult in underserved communities. Barriers such as lack of insurance, transportation, and nearby facilities can hinder individuals from receiving the care that they need. Changing demographics and trends. The landscape of substance abuse is constantly changing. With new substances and changing patterns of use, the organization needs to continuously update and refine its strategies and programs. Additionally, the changing demographics means that they must adapt to meet the diverse needs of the population that they serve. Let us now focus on how the challenges are addressed. Public awareness campaigns are crucial as the organization tackles stigma and public perception. These efforts aim to educate the public, reduce stigma, and promote the understanding that alcoholism and drug dependence are treatable health conditions, which encourages those affected to seek help without fear or judgment. Diversified funding resources. To address funding challenges, NCADD has diversified its funding sources. By seeking private donations, corporate sponsorships, and forming collaborations with other organizations, they reduced their reliance on a single source of funding. Advocacy efforts. NCADD engages in ongoing advocacy to influence policies at local, state, and federal levels. These efforts include lobbying for legislation that supports prevention, treatment, and recovery services. By working closely with policymakers, they ensure that these issues remain a priority. Collaboration and partnership. Through collaboration with various organizations, healthcare providers, and community groups to enhance access to treatment and supportive services, they've created an inclusive and integrated approach by pooling resources and expertise for better outcomes. Adaptation and innovation. By incorporating evidence-based practices and staying informed about new research and trends, they've ensured that their services remain relevant and effective. We conclude with how NCADD overcomes challenges. Commitment to mission. The unwavering dedication to its mission is the foundation for overcoming challenges. This commitment drives all of their efforts and inspires their staff and supporters to persist despite obstacles. Strategic partnerships. By partnering with other organizations both within and outside the field of substance abuse, as discussed before, they gain additional resources, expertise, and support. These collaborations lead to innovative solutions and more effective programs. Advocacy efforts. Persistent and planned advocacy is essential for securing supportive policies and funding. By ensuring that the needs of the individuals struggling with alcoholism and drug dependence are represented and addressed at all levels of government to influence positive change. Dedication of staff and supporters. The passion, expertise, and the commitment of the staff and supporters are vital to the success of the organization. Their dedication drives the implementation and the sustainability of the programs and services. Recognizing and valuing their contribution helps maintain morale and motivation, ensuring that the NCADD can continue to overcome challenges and achieve its mission. Now, Christian will address the applicable concepts. Thank you.
Thank you, Heidi. These concepts are drawn from Donald Pamphlet's mergers, acquisitions, and other restructuring activities, and their application to the National Council on Alcoholism and Drug Dependence, a coalition focused on substance abuse treatment. They are strategic alliances, motives, and SWOT analysis concepts. In Chapter 1 of De Pamphlet's book, mergers and acquisitions are defined as corporate restructuring activities including mergers, acquisitions, joint ventures, and alliances. Applying this to the NCADD, the organization could form strategic alliances with pharmaceutical companies to collaborate on developing new addiction treatment drugs. For example, this NCADD could partner with a pharmaceutical firm to fund research on a new medication for opioid addiction, combining their expertise in addiction treatment with the pharmaceutical company's drug development capabilities. Another concept from the course book is motives, which include achieving economies of scale, gaining market influence, and diversifying operations. Applied to the NCADD, these motives suggest the organization could consider acquiring smaller regional counseling centers to expand service coverage and increase community impact. For instance, acquiring a local counseling center specializing in youth addiction treatment will allow the NCADD to offer broader services and support more vulnerable populations, thereby enhancing its effectiveness in addressing addiction issues. The third concept is SWOT analysis, which evaluates strengths, weaknesses, opportunities, and threats of organizations. The NCAD might conduct a SWOT analysis before acquiring a community-based addiction recovery center to assess strategic fit and potential risks. For instance, strengths could include strong community relationships, while weaknesses might be outdated facilities. Identifying opportunities such as enhancing outreach programs would guide the NCAD in integrating the center effectively and improving services to the community. By applying these theories, the NCAD strategically navigates mergers, acquisitions, and other restructuring activities to strengthen its position in substance abuse treatment. Each example demonstrates how strategic alliances, acquisitions, financial analysis, and ethical considerations can expand the NCAD's reach, enhance services, and fulfill its mission of supporting individuals affected by alcoholism and drug dependence. This covers the concept portion.
Next, we will show you a brief explanation video on the SWOT analysis.
Both organizations and individuals use a SWOT, or Strengths, Weaknesses, Opportunity, and Threats analysis, as a jumping-off point for new projects and improvement initiatives. It's a way of analyzing the internal and external factors that will impact a product, project, place, or person. Because the SWOT framework uncovers opportunities for success and highlights threats, it's a powerful method for decision-making when starting a new venture. SWOT can help businesses identify a new market niche, for instance, or help individuals plan career success by maximizing strengths and highlighting threats that might inhibit achievement. Think of SWOT as a framework and method. SWOT analysis is usually executed with a SWOT matrix, a square divided into 4 quadrants that represent each element. Various tools exist to help entities complete SWOT analysis or fill out a SWOT matrix, and usually involve asking questions under each category, such as, what do you do better than anyone else? What market trends could increase sales? And where do your competitors have a market advantage?
My Astro colleague Julio Cordova will now handle the theory section of our project.
Today, I will focus on 3 theories of addiction and substance abuse. They are biological, behavioral, and neuroscientific. These theories come from the NCAD and articles from FHE Health Institution. Biological theories. Did you know that genetics play a big role in addiction? Studies on families, including identical and fraternal twins, siblings, and adoptees, show that genetics can account for up to 50% of an individual's risk of becoming addicted to substances like nicotine or alcohol. Behavior theories of addiction suggest that repeated drug use strengthens the association between the substance and its effects. Essentially, the brain learns that using a particular drug results in a predictable response. The effects of the drug, as well as the social interaction that go along with using it, may be the driving force behind this reinforcement. Rooted in the brain. Neuroscientific theory suggests that drug addiction is rooted in the brain and are among the most common explanation for addiction. Different drugs have different effects on the way the brain functions. In general, substance triggers the brain's reward system of stimulate endorphin releases, which help relieve pain or cause the individual to express a sense of well-being. In simpler terms, learning about the biological, behavioral, and neurological aspect of addiction can lead to better ways of preventing and treating it, ultimately benefiting those impacted by this challenging condition. Sadly, theories of addiction and substance abuse in children do exist. Early drinking significantly increases the risk of alcoholism. Kids who start drinking before age 15 are 4 times more likely to develop alcohol addiction than those who wait until age 21. Regardless of genetics or environment, continuous alcohol use can lead to addiction and disrupt brain development. Delaying alcohol use is crucial for preventing alcoholism and promoting healthier youth lifestyles. In the next clip, former NBA player and motivational speaker Chris Herron offers hope to those battling addiction.
7 of my best friends in high school turned into heroin addicts. We all started with a mom in a living room drinking her beer. We all started off, asking some adult to walk into a liquor store and get it for us. I mean, we all begin there. I think as parents, we need to make it harder for our children. We have to make it less accessible. I believe when it comes to addiction, we've gone horribly wrong with the way we present it to our children. Over the last 7 years, I've dedicated most of my life to traveling the country, sharing my story, and over the last 4.5 years, I've shifted it more towards prevention. I just think as a culture in general, we've accepted kids getting drunk on Friday nights. We hover over our children's grades. We stand on the sidelines. But on a Friday and Saturday night, it's our weekend. It's not theirs anymore. All that pain as a boy. Well, first and foremost, we don't ask our kids why. You know, when your kid comes home drunk on a Friday night, the first question is, who were you with and where were you and, you know, what were you doing? And nobody asks why. You know, why is the only one that really matters at the end of the day. Kids need to be challenged socially and checked in on emotionally. We don't do it enough. I think prevention starts with all, not just home. I think it starts with all of us. You know, it begins and ends with a community.
To conclude our presentation, we want to highlight 2 takeaways. First, the Ncadd has been successful in dealing with alcoholism and drug dependence through their advocacy efforts, education initiatives, support services, collaborations and partnerships, fundraising and sustainability by staying committed to its mission, then taking an idea focused on addressing alcoholism and drug dependence and growing it into a viable success by making a meaningful impact on individuals, families, and communities affected by addiction. Second, the Ncadd employs a comprehensive approach to address alcoholism and drug dependence through their diverse goals and activities, encompass increasing community awareness, and utilize effective strategies to achieve positive outcomes. Heidi will now wrap us up with our recommendations.
Recommendations. As a group, we recommend Ncadd to implement and standardize data collection tools across all programs and train staff and volunteers on data collection protocols, ensuring consistency and accuracy. Additionally, enhancing data analytics abilities by hiring or training staff with expertise in data analysis and investing in data analytics softwares. This will help manage and analyze large data sets. Transparent reporting on program outcomes is also essential to build trust with stakeholders. Finally, fostering a data-driven culture within the organization will ensure continuous improvement and success. By adopting these recommendations, Ncadd can significantly improve its data practices, leading to more effective programs, evaluations, better decision-making, and increased success in securing funding. As a group, we thank you for your time, and if you or your loved ones need support on their recovery journey, please contact your local Ncadd organization. Thank you.